All right, we're picking up with burns here. All right, so what's a burn? It's a damage caused by heat. It could be electricity, radiation, or certain chemicals. So the most immediate threat is dehydration and electrolyte imbalance. These things would lead to shutdown of uh, the kidney and circulatory shock. And when you have circulatory shock, right, your entire system isn't going to operate properly. So, first degree, right, we've heard of this, but this is the epidermal damage only, right? We have some swelling, we have some redness, and it is painful. Second degree, we have still in the epidermal layer, but also part of the upper dermis. And we can get blisters here. And these two, both first and second degree, are called partial thickness burns because it's the epidermis and or the epidermis and only the upper dermis that are involved. So these would be considered a partial thickness burn. Whereas third degree is full thickness. So that kind of gets used interchangeably there. And the skin color turns gray-white, cherry red, or is blackened. There's no swelling at that point. You've burnt off too much tissue. Also, it's not painful in the third degree area. Again, when you're talking about burns, it's likely that in in the diameter of the lesion, that you would have an area that is third degree, second, and then first, depending on the onset. So just because someone has full thickness burns doesn't mean there aren't areas of pain, right, where there might be more second or first. But this is like a medical emergency, and then also we're going to have to use skin grafting and treatment, most likely. So this is a great image for this. So first degree, second degree, the upper dermal layer right here. So first degree, second degree, and then third degree. We've gotten a lot deeper. And this is what I mean, right? So the periphery here is going to have some burn in the painful region where there's still pain for that. Here's a picture of first degree burn, right? Sunburn is typically like this, but a sunburn can lead to blistering. This is a water burn, also first degree. So this can happen when you're driving with hot coffee. So if you haven't done it in your life, just if you get a coffee to go, let it sit for like 10 or 15 minutes before you pick it up. Second and third degree. So the graphics get a bit worse here, and I'll only keep this video up temporarily on YouTube because it's like it's a YouTube issue because of the graphicness. Okay, so second degree burn, you can see the blistering forming here. You see the skin peeling back here from the most superficial layer, and it's gotten into the upper dermal layer, right? Which is why we have the fluid coming out and bubbling up. It's putting pressure on the epidermis, right? Okay. Also, second degree hot water burn here, and you can see that the integrity of the epidural layer has been compromised, and that you're into the dermal layer. It makes sense, right, that we're seeing the blood vessels here having been damaged or exposed. You have bleeding coming out. Here is a nitric acid burn. This one is going to, this is a large area, and this one, I'm using it as an example for grafting. So let's look at grafting here. So you can see the necrotic tissue. This is later, so this is, again, this is at first, immediately with the exposure, and then this is when the tissue is dying off, okay, within hours of the exposure. And then we have to get rid of that necrotic tissue. So it's still black up here, you could see, but let's just go back 2 slides. If all of this dead tissue needs to be removed so that the healthy tissue can grow, because of the depth of the penetration of the burn, right, which is what this is saying here, is that it's going to require the grafting because these cells can't approximate well enough to cover that space and regenerate properly. So here we have debridement first, so that necrotic tissue was debrided or removed. Split skin graft here is applied. So this is when there is skin from a different source. You could take it from a non-burn site, peel it off here, and then you run it through a little machine, and you can place it onto the site of the burn. So let's talk about why that works. So if this is the healthy skin and we take it and it has the healthy tissue repair in it, then we run it through this little hole puncher, and that allows for the cells to creep and crawl along, right, and have a scaffolding to regenerate the tissue. So that's why this is done in this way. What's important here, just like a recent thing, more recently we're talking about using part of the hypodermis. So this would be the dermal layer, the epidermis, that gets peeled off. But if you take more of the hypodermis as well with it, you actually get less scar tissue, which in their nitric acid burn isn't really as relevant as far as cosmetic appearance goes. But when you have a burn on your face and you need to regenerate that skin, it seems to be that the research is showing that it's better if you take a deeper sample portion with the hypodermis, and then there's better cosmetic results as a result of that. Oh, so this is how beautiful it can look after the skin graft comes up and this tissue is repairing itself. So again, this would be the grafting site to harvest the skin, and then it was applied to where the burn was. What are critical burns? Well, you can see the rule of nines is in your book. It's a good one to go over how we calculate what percentage of the body is affected by the burn. So you can look at rule of nines in the book, and then you just do the math to add up. If it's more than 20% of the body with second degree, more than 10% with third, and then if it had face, hands, or feet. So any one of those three would be considered a critical burn. Face, hands, and feet, right, are critical because of the effect that it has on your ability to function. And the face, especially with burns, you can also have a swelling in the throat, and that can also be lead to respiratory issues. So that's also why it's a critical situation. Right, we talked about debridement, removing necrotic tissue, and antibiotics will help with the recovery, covering it, and then skin grafts eventually if that's necessary. So you could debride burnt skin that isn't going to require skin graft as well. And if you're doing wound treatment at all, there's a lot of different times. Regardless, you're not talking about burns here, but where debriding of necrotic tissue is necessary for healthy regeneration. What else about integument? Oh, wound repair. Let's pause here.